Good morning, everybody. Blackout, huh? Tough storm. My name's Ed Roth. I'm a program assistant with the SHINE program. I used to be the region director, but I decided to back out a little bit. But I actually haven't backed out much, but that's the way it is. I'm very happy to be here in Lancaster this morning to talk a little bit about Medicare updates for 2018. And that's basically what I'm going to talk about. I'm going to talk updates to Medicare plans, and how they changed for 2018. Not a lot of changes, but there are some changes, okay? So I just want to go over them briefly if I can. And if you'd be patient with me, we'll see if we can get through this in a reasonable time. We'll hang around after the meeting. Marilyn is also a SHINE counselor, and you also have a SHINE counselor here. We have Barbara Bloom here as a SHINE counselor. Okay, so we do have SHINE counselors that come to the Lancaster Senior Center on a regular basis. So the first thing I want to talk about, changes to Medicare Advantage plans. Do we all know what Medicare Advantage plans are? Okay, we all have them. Medicare Advantage plans are the Tufts Medicare Preferred Plan, the Blue Cross, Blue Shield, HMO, and PPOs, Fallon Senior Plan, Harvard Pilgrim Stride plans, and United Healthcare has a couple of HMOs and a PPO that are available in Worcester County. Okay, so these are the plans that they contract with Medicare, and once you join one of these plans, Medicare is basically no longer responsible for your health care. That plan is. The plan pays Medicare several hundred thousand, maybe $700 a month to take care of you. Therefore, that plan is responsible for all of your Medicare coverage, and it does provide the same benefits that original Medicare provides, and it might provide some additional benefits like dental care or vision, or sometimes some hearing benefits. Now, these plans generally have a premium, and they have co-pays and deductibles as you go through the plan year. You have a doctor's visit, you may pay a $20 copay. Okay, you have a doctor's visit, you may pay a $20 copay or something like that. You go into the hospital, you may have a copay for the hospital. Is everybody on Medicare here? We are, okay. Show of hands. Beautiful. Some people are not new to Medicare. Okay. All right. So that's a little bit of how Medicare Advantage plans work, okay? Do some people have some of these types of plans? Fallon, Tufts, something like that? Okay. Some people have retiree plans. Some people have state GIC plans. Okay. Just want to get a feel of the audience. So, there is a new Medicare Advantage plan in the area. Aetna Insurance is promoting that plan. It's 2 HMOs. We have no experience with it. You don't quite know what the network looks like. No idea really if your doctors are covered. And with all of these plans, the first thing you've got to do, you want to make sure your doctor is covered in the plan that you're looking at choosing. Okay, you want to make sure your doctor takes the plan and has a contract with the plan. Okay, before you do anything else, because if you join a Medicare Advantage plan and you don't, and your doctor isn't covered, you could be out of network for that plan, and if it's an HMO, it would not pay. So you want to make sure your doctor is in that plan's network. So again, with the new plan, no real experience with it. We're not sure about the network, so it's out there. You want to try it. The deal is make sure that your doctor is covered in that particular plan. Some of the regular plans we've had for years, Blue Cross, Blue Shield, Medicare Advantage plans, they have 3 HMOs and they have 2 PPOs. Now the premiums in Worcester County have gone up a little bit, and they've had some changes to their preferred pharmacies. Okay, but the premiums have gone up a little bit for the Blue Cross plans. So So you probably saw that. I know I got a call. Somebody in one of the other counties had a friend, somebody in Worcester County had a friend sign up in Middlesex County. Middlesex County got a decrease of $3. Their friend who urged him to sign up got an increase of $7. So the friend in Middlesex was all excited. The friend in Worcester County, hey, I didn't get that. Why didn't I get that? They called me. So some of the Blue Cross plans have had an increase in Worcester County. You follow me? You're going along with me a little bit? Yes, ma'am.
I'm sorry for being ignorant, but I don't know what a PDP is or a PPO.
A PP, what do you want, PDP?
Yeah, what's
Yeah, prescription drug plan.
Okay, what's
A PPO is a preferred provider organization. Okay?
Okay.
You got me?
Gotcha.
Okay? With the and I'll talk a little bit about later. A preferred provider organization, it's a little bit less restrictive than an HMO. Okay? You got to have a doctor that's in the network, but you can go out of the network without referrals, but you're probably going to pay a little more money when you do. Okay? That's a PPO. The HMO is strictly network plans, okay? Now Fallon Senior Plan that's been around for years. They have a new plan called a Flex Enhanced RX HMO with a 0 monthly premium. All counties accept it, and it's a good thing, a nice thing about it, it's a zero plan, zero premium plan. So these programs, the Fallon program has maybe 6 or 7 plans available in Worcester County. Okay? Their prices range all the way from $0 a month for a premium up to $200 odd a month for a premium. Okay? So the more you pay for a premium, the less you're going to pay in co-pays throughout the year. That's just, I was serving, okay. Come in. Oh, no problem. I have plenty of time. I have all morning. So I don't have to work till this afternoon. Everything just open enrollment. Okay, so they have zero. Some of they have zero. So if you get a zero plan, you can expect usually to pay a higher copay when you go to the doctor. Okay. Now there's been premium increases for all their other plans. Copays have increased, and diagnostic services for the Fallon plan, they have a zero copay, but not for MRIs. Okay, not for MRIs. All right. Now Harvard Pilgrim plan, that's a plan that's promoted by Harvard Pilgrim Insurance. They have 2 plans. They have a Harvard Pilgrim Stride plan and ambulances. And with that plan, emergency room and ambulances have increased on both the existing plans. There's been premium increases of $4 to $9 in plans from their 217 rates. And with Harvard Pilgrim, that plan has $150 a year over-the-counter allowance for over-the-counter drugs. What that basically means is you can be reimbursed for over-the-counter products by that plan, up to $150 a year. Okay, so that's a good plus. Tufts Medicare Preferred Plan, again, has seen an increase of $7 for their plans in overall. Now they too have an HMO Saver RX with the 0 monthly premium. Out-of-pocket max increase to $4,500. Let me explain out-of-pocket maximum just a little bit. Okay, all of these HMOs and PPOs have an out-of-pocket maximum. That out-of-pocket maximum is the most that you can spend in a calendar year, okay? And after you reach that amount in a calendar year, the plan will not charge you any more for copays or deductibles, okay? The Tufts plans, for the most part, have an out-of-pocket deductible of $3,400 for that calendar year for most of their plans, with the exception of the zero premium plan, where that out-of-pocket has gone up to $4,500. Now, most other companies charge more money generally for that out-of-pocket, on that out-of-pocket line. Most plans will charge $6,700 for that out-of-pocket, okay? So what that means, very simply put, you have to spend $6,700 before you don't have to pay any more for your services, okay? Now, my interpretation of that is this: you have to have a very bad year to hit $6,700 in out-of-pocket costs. You have to have a very bad year. A very, very bad year. With the $3,400 out-of-pocket cost, you have to have sort of a bad year, okay? So again, the out-of-pocket costs are important because that's when you can, you won't have to pay any more for your office visits and co-pays with these plans. Yes?
That doesn't include hospital. Hospital stays don't go towards that out of.
Hospital stays go towards that
They
out of
do.
pocket. They do.
Okay, so
If
that's
you're
your-
paying,
that's your
if you
maximum
pay,
exposure.
if you pay $350 a day
Yep.
for the hospital,
Yeah,
okay, that will go towards that.
okay.
But I mean, you know, it's 5 days, 350. That's $1,800.
Mm-hmm.
You have to spend a little bit of time in the hospital. Okay, you're gonna have to spend a little bit of time in a hospital. Another plus with well, sort of a plus with the TUS plans, and I'm not pushing them, it's just the facts are the facts, and I'd like for people to know the facts. The facts are the facts, and that is this. You see with that zero plan, there's also a 20% copay for Part B medications, okay? Now that's in the zero plan. Now Part B medications in all of their other plans have a zero copay. What are Part B medications? Part B medications are injections and infusions you may get in a doctor's office, or you may get in a hospital, okay? And these injections and infusions can and do include chemotherapy medications, okay? And they're all usually very expensive medications. So if you're having a bout of cancer or something, and you're going through chemotherapy, you're going to have to pay 20% of the cost of these medications in most plans. With the TUS plans, it's zero, with the exception of the zero plan. Okay. So again, if you're going through a bout of cancer with some of these other plans, you could hit that $6,700 pretty quickly. But to be honest with you, but it's coming out of your pocket, so you want to be a little cautious. And I don't know what you can do about it. You know, there's not much you can do. That's just what the plans charge. Okay. Any questions? Yes.
Why is there a difference between, in the other plans, which county, whether you're in Bristol County
They're
or
all.
Worcester
They're all.
County?
Tell you why.
Good.
You want the long or the short?
Short.
Okay, the short. Okay, we live in Worcester County.
Yeah.
Okay, Worcester County happens to be the highest cost place in the state, I believe. Okay, they set these actuaries set these premiums. Okay, and they let Medicare know. Medicare approves them, but it's all based on what it costs the plan history, and evidently it costs the plans more money to take care of you in Worcester County than it does in other counties.
Right.
Okay, so that's the deal. That's how it comes down. Okay, so it costs them more money, whether it be for hospitals, for doctors, this, that, and the other thing. Maybe you're a little sicker. Maybe we're even a little bit older. I don't know. Okay, maybe we're a little bit older. Maybe we have a little bit older population. You know, we're aging. We have more people that are 80 than other counties. I don't know. But that's the reason. It's not a scam. It's an actual basis they do. They have to get approved by Medicare. All of these rates on these Medicare Advantage plans have to be approved by Medicare. Okay, because they're involved with the government. okay? The next thing I want to talk about is United Healthcare, AARP. United Healthcare pays AARP a certain amount of money, probably somewhat substantial, to sponsor that. Use their name. Okay, so United Healthcare is a big system throughout the country. Okay, they have a lot of plans throughout the country, and they just moved into Worcester County last year with three HMOs and a PPO. Okay, they have a network. You know, you need to check your doctors. Make sure you check your doctors, particularly with all of these plans, particularly with the United Health. I had a problem myself. I went online and looked, and my doctor said my doctor was covered, and I asked my doctor, no, he's not covered. So, got to be a little cautious with some of these. These are big outfits, okay, and they're national outfits. Sometimes what you might see online might not necessarily be accurate, and it's on you to check this stuff out. Okay, it's on the consumer to check this stuff out, because you don't want to make that mistake and run into you have to pay out of network, and it can be a multi-$1,000 mistake if you're going to pay out of network with some of these plans. Okay? Any questions?
Thank you.
Yes.
So some of the Advantage plans don't have an RX component. What are some of the cautions of?
Well, most of the
purchasing?
Medicare Advantage plans have have drugs included in the plan, so you don't have to get a separate Part D plan. Okay, most of these plans have drugs included in the plan. Now some don't. Okay, so the bottom line is this: if you're taking medications, and you're in a Medicare Advantage plan, you have to get a plan that has medications. You cannot get a separate standalone Part D plan if you're in an HMO or PPO. Now those plans have them. They may be good for veterans or something like that who may get their medications through the VA system. So maybe they get a little backup with one of these HMOs. Okay, so they're good for that. But again, you have to get your medications through. You have to get a plan that covers your medications on these HMOs and PPOs. Okay? Any other questions? All right. Moving along. Where's my thing? What's next? Who can tell me? People paying attention here. Let's go. Complicated subject. Usually people need tables to write stuff down on this one, but here I go. I'll do the best I can. Part D standard benefit. Back in 2006, that's 10 years ago. Actually, it's longer than that, probably 12 years ago. Congress came up with a program to help seniors pay for their medications. It's called Part D, Medicare Part D. Medicare has four parts. Part A, hospitalization. Part B, doctors and medical. Part C, Medicare Advantage plans. And Part D, prescription drug coverage. So they come up with this plan. Now, and they said that Medicare Advantage plans have to provide drug coverage within their plans. And the way a drug plan works is this, okay? There's a deductible of there can be I'm not going to say there can be a deductible of up to $405 in 2018. In 2017, it was $400. Some of you may experience this, I don't know. But it doesn't have to be $400. The maximum it can be is $405 for 2018. Some drug plans charge less. And some drug plans don't have any deductible at all. Okay, the deductible is you have to pay this amount before the drug plan starts to pay. Like a deductible in any corporate plan you had. You had to pay that X amount before the plan starts to pay. So again, for 2018, that deductible can be as high as $400 a month. It's not necessarily in all plans that it's that high. A lot of plans, it's less. The initial coverage limit. In 2017, the initial coverage limit was $3,700. In 2018, they've raised that by $50, and the initial coverage limit is going to be $3,750. What is the initial coverage limit? Does somebody want to know? It's usually a good question to ask. That's why I thought I'd ask myself about that. Okay, so what is the initial coverage limit? The initial coverage limit is the amount of money that you pay and the drug plan pays for drug costs, okay? That you pay and the drug plan pays. Once it reaches $3,700 that you pay and the drug plan pays, you're then in what they call the coverage gap or the donut hole, okay? You're in a donut hole. And next year it's going to be $3,750. Okay, $3,750, okay? But it's the amount of money that you pay and the drug plan pays. Okay, so what's that mean? Generally, and by law, the drug plan has to pay, in this initial coverage period, the drug plan has to pay 75% of the cost of the retail cost of medication. You can be responsible for as much as 25%. Okay? Sometimes that 25% is zero. Okay? Now, many of you have co-payments for some drugs that you don't have any co-payment at all. Okay? Sometimes it's zero. Okay? But here's the bottom line of the thing. Every month or so, you get a little statement from your drug plan or your HMO or what it is. It tells you where you stand in your plan. Tells you how much you spent. Once you're starting to reach about $800, you want to be concerned that the donut hole may be around the corner. Okay, and you might be in that donut hole. You might be getting close to that donut hole. Now, when you reach that donut hole, okay, you're going to have to spend, as it stands right now, 35% of the cost of a brand name medication and 44% of the cost of a generic medication until you get out of the donut hole. When does that happen? You get out of the donut hole when you have spent out of your pocket $5,000 totally. Poor lady had a stroke.
Yeah, I was going to say.
Okay? Now the good...
Out of pocket or combined?
I'm going to tell you, I'm going to get to that, okay? Until the cost of your medications have reached the amount of $5,000, okay? So you're in the donut hole. You have to pay these huge co-pays for your medications. Hey, folks, before the Affordable Care Act, you used to have to pay 100% in the donut hole, okay? Now the Affordable Care Act is in force currently today, October 31st of 2017, okay? The Affordable Care Act is still with us. We have a reduced amount we pay, okay? So that's a blessing. But anyway, until the cost of the retail cost of your medications reach the $5,000 level, then you're out of the donut hole. Now, that $5,000, you're paying 35%. Guess what? The entire retail cost of that medication goes towards the $5,000. Okay? So you get out of it, you get out of there a lot quicker than what you may surmise, what you might think. The entire retail cost of the medication goes towards reaching that $5,000. So they're not waiting for you to spend $5,000 out of your kick. It's all based on the retail cost of the medication. Okay, so it's a little bit less onerous than it could be. Okay, that's a little nutshell vision of the donut hole. Now, once you're in that out of the donut hole, you make catastrophic coverage, and your cost of your medications can get down significantly. Okay, can get down significantly. All right, now just a word of advice. Less than 10% of the people on Medicare reach the donut hole. Okay, less than 10% of the people on Medicare reach the donut hole. Okay, usually they stay within the initial coverage period. Okay, and there is help for people that get into the donut hole. Massachusetts, we have a program called Prescription Advantage. We'll talk about it probably in one of the last slides in the presentation. Okay, that's a program that can help you if you do get into the donut hole. Okay, any questions? Now again, these are standalone drug plans and the drug plans that are within your HMOs and PPOs. Yes, ma'am.
Does original Medicare have a drug plan automatically?
No, you have to join.
Okay.
Okay? That's a standalone Part D plan. Okay? And there are 34 of them, no, 21 of them in Massachusetts. That if you just had original Medicare and maybe a supplement program, you could join a Part D plan to get your medications. Question? You all set? Okay.
Well,
Yes?
what's that $107 a month that everybody pays out of their social security? Isn't that going?
$107 a month that everybody pays.
Yeah.
107. How many people in this room pay $107?
Maybe I'm wrong.
Not everybody. I want to get to everybody.
109.
How many pay $107? 1, 2, 3. So everybody doesn't pay that.
214.
That's the bottom line. Some people pay more.
Yeah.
Okay? So I'll answer the question briefly, then here's the deal. You might pay 107, you might pay 109, you might pay 104, you might pay 121, you might pay 134. Okay? And you might pay 100, you might pay 187.
That's for one.
Okay? For one.
A.
Right, so that, yeah, they have all these premiums right now. Oh my God, they got all these. So here's the deal. Why does this happen? Okay, so,
Were you
And-
asking why does it happen? Or what
yes.
it's for?
Why does it happen?
No, I was asking, I thought she was asking what's the money for?
What's the what?
What
the
does it go
premium pay
towards?
for?
Oh, it's Part B.
Which is,
Medicare Part B. Doctors, hospitals, doctors outpatient services. Medicare Part B has a premium associated with it. Okay? And Medicare Part A does not. Okay? You have to pay the Medicare Part B premium in order to get any services under
social security.
any of these services, whether it be through an HMO or through original Medicare. You have to pay the Medicare Part B premium. Yes?
Who pays for Part A then?
You do. You paid it.
Taxpayers.
You paid your Part A through your working career.
But that's what they
Okay?
count.
You paid a Medicare tax. When you worked, you paid a Medicare tax. Or if you're older, you might have paid into Social Security, something like that. But you paid a Medicare tax. Okay? So Medicare was hitting you when we were younger. Okay? They were hitting you for a couple of short dollars every month, maybe $10, $12 out of your check every week or something. So you paid a Medicare tax. That's what funds the Medicare Trust Fund. Medicare Trust Fund pays for Medicare Part A. Okay? So that's how Medicare Part A is paid. Medicare Part B is a different deal. Medicare Part B is funded through the premiums, basically. And they tap in the trust fund periodically, I believe, but I'm not too sure. Okay? So that's how it's funded. Now, there's different premiums going about. All right? There's different premiums. Okay? So Medicare can cost anywhere from $107, probably $104, I think, all the way up to a whole lot of money. Explain that briefly. 2015, I don't think we got a cost of increase in 2015. Cost of living increase in your Social Security. I think it was 0. So when you get a 0 cost of living increase in your Social Security check, the Medicare premium cannot go up. cannot increase. Okay? Cannot increase. So there was no increase in 2015. But somebody new to Medicare, if you just joined, you paid more. Because you were new, you paid maybe $121. Okay, 2016, we got a small increase, 0.03%. Okay, was your increase in 2016. Your Medicare premium couldn't go up with that small an increase. So it kind of stayed pretty close to the same. In 2018, 2017, same thing. 2018, we're going to get a 2% increase cost of living. So that Medicare premium that you've been paying $107, $119, boom! You're gonna pay more money for that Medicare premium this year. Okay, that cost of living increases isn't gonna be in your pocket very long. Okay, it's gonna come out and go towards a Medicare premium. All right, so and what may happen is this. I've seen this happen. They may just level everything off, and everybody will pay the same premium, maybe around $127 or $128. That premium has not been announced as yet, okay, for 2018, okay? But the Medicare Part B premium is for your doctors, outpatient services, and stuff like that. Part A premium is for your hospital room and board and all the stuff, so associated with the hospital. Part B is the ER. ER is Part B, okay? The hospital stuff, you're admitted. Once you're admitted, Medicare Part A will pick up most of the expenses for the hospital, okay, with the exception of the deductibles and copays that are associated with Medicare. Okay? Anything else? Okay. Extra Help, LIS, that's a program that's available to low-income people to help them pay for their Medicare drug plans. Okay? If your income is below about, I think it's $1,530 or $1,580 a month, you may qualify for some level of extra help. That's a single person. For a couple, I think it's around $1,800 and change. You may qualify for some level of extra help. See a shine counselor. They'd be happy to look at it with you. Okay? All right, that's extra help. And if you do qualify, there's 7 plans, 7 Part D plans, standalone Part D plans that you would have a zero premium if you qualified for extra help. Okay. Medicare Disadvantage enrollment period. If you're in a Medicare Advantage plan and you're not happy with it, something's going on, your doctor got out of the plan, something's going on with the plan, your hospital's no longer covered, now's the time to change. Also, you can change during the period of January 1st through February 14th. You can get out of a Medicare health plan, Fallon, Tufts, Blue Cross Blue Shield, HMO, and go back to original Medicare and pick up a supplement plan and a Part D plan. You can do that during that period of time. It does not allow beneficiaries to switch to another Medicare Advantage plan or switch from original Medicare to a Medicare Advantage plan unless you're using a 5-star plan, okay? There's only one 5-star plan available in Worcester County in Massachusetts. That's a Tufts Medicare Preferred Plan. That's a 5-star plan. It's a good deal. You can enroll in one of them anytime during the year, okay? That's a special deal for Medicare where you can enroll in them anytime during the year, okay? Now, 2018 Medigap supplement plans, okay? I talked about Medicare Advantage plans, how they're run by Medicare. Medicare pays that plan X amount of dollars to take care of you once you join, okay? And that plan becomes your primary coverage. That plan becomes your primary coverage. Medigap supplement plans are plans where you continue to have your original Medicare A and B, okay? And you buy a plan to supplement the A and the B. Medicare A and B don't pay everything, okay? There are gaps in Medicare A and B. For 2017, those gaps include $1,316 deductible if you're admitted to the hospital. You have to pay the first $1,316 out of pocket. For Part B, you have to generally pay the $183. The Part B deductible of $183 you have to pay out of pocket at the beginning of the plan year or whenever you join Medicare. Okay, there's $183. This is 2017. They're gonna bump up in 2018. Don't know what the numbers are yet. Okay, so you have these costs associated with original Medicare. The final cost is if you go to a rehab or a skilled nursing facility. Okay, you have a fracture, a hip break, or something like that. You get ill. Once you go into rehab for a while, Medicare Part A will pay the first 20 days. Days 1 through 20, no charge in a rehab. Okay, as long as you're admitted after an admission to a hospital. Okay, no charge. But after day 20, day 21, there's a $164 copay per day if you're in a rehab longer than 20 days. So these are the copays and deductibles associated with Medicare Part A and B with original Medicare. So if you want original Medicare to continue to be your primary coverage, they have supplement plans. They have two types of supplement plans. They have a supplement core and a supplement 1. Supplement core plan does not pay those deductibles or the copays. So that's still your liability. But it will pay with Medicare Part B. After you pay that deductible, Medicare pays 80% of the bill, and you're responsible for 20% of the bill. Okay, 80-20. Okay, that's fine. Man, that's not much. Okay, maybe it's not much, but maybe it is. If you go to the hospital for a procedure, okay, my late wife was in a hospital procedure. It cost her $20,000. It cost $20,000 of the bill. Now, if we didn't have any other insurance, we were depending solely on Medicare. 20% of $20,000 is a lot of money. Okay, so a lot of people want to get some extra insurance, some Medigap coverage. Okay, so again, that core plan doesn't cover the deductibles, but it does cover that 20%. Chemotherapy, you're getting about a cancer, you're going to get chemotherapy. It's going to pay up 20% of that chemotherapy. It's going to pay that. Okay? Medicare Supplement 1 plan, more expensive. More expensive, okay? But it covers everything that Medicare doesn't pay. Okay? Covers everything that Medicare doesn't pay. Some of you may be familiar with the MedX Bronze program. That's a Supplement 1 plan, okay? And that plan covers everything that Medicare doesn't pay. But none of these plans cover medications. Incomes, the standalone Medicare Part D plans that cover medications. Okay, incomes, the standalone Medicare Part D plans to cover medications. Okay? Rates for these plans, the Supplement 1 plan, the cheapest plan available in Massachusetts are Blue Cross plans. Say why. There's 7 companies that sell these plans. Okay, they're all regulated by the Massachusetts Division of Insurance. Okay, that's who regulates the supplement plans. They have nothing necessarily to do with Medicare. Okay, the HMOs and the Medicare Advantage plans are regulated by Medicare. Their services have to be approved by Medicare. Massachusetts Division of Insurance regulates the Medicare supplement plans. All of the plans provide identical coverage. Okay, they may throw a few things in here and there, but they provide identical coverage. All of the core plans take care of what Medicare doesn't pay. Take care of the, except that they don't pay the deductibles. The supplements pay whatever Medicare doesn't pay. None of these plans are networked. Supplement plans, you go to any doctor you want to go to. Supplement plans, for the most part, have foreign travel. You can get on to Florida with a supplement plan, okay? And you show your card and you'll be all set. You go overseas with a supplement plan, I'd take your own private plastic, and then you'll probably get reimbursed by the plan, okay? You will in most cases, all right? So there's a couple level with the supplement plans. So that's how they work. Any question? Yes?
I have a question. So, I go to Florida for 4 or 5 months, so I need to get the Medic's bronze? Is that what I need?
If you go to what, honey?
Florida for 4 or 5
Florida.
months.
If you go to Florida
What's,
and you want to be covered, okay, and for anything but emergency, okay, and critical care and urgent care, you should get a different type of coverage. The HMOs will cover you for emergencies.
so any of those companies would have this Medic, so there's only certain companies that would cover me?
No, any of those supplement companies would cover you that are available. Oh, I don't have a list of them.
Blue Cross covers it.
Excuse me?
Blue Cross. Blue Cross covers it.
Blue Cross Bronze, right,
Right.
Blue Cross supplement, right. If that's what you're interested in. Question?
Well, I don't quite get, when you need a Medigap insurance or when you need a regular an HMO. I don't quite get the difference there. Is there a difference? Are we talking about two different things?
Two different ways,
To have insurance?
two different ways to get your insurance.
And why would you choose one way over the other? Why would you get Medigap instead of regular HMO?
Okay. Medigaps have no
Network,
network,
okay.
okay? Go anywhere you want to go.
So that's basically what you were,
Medigaps have no
Yeah.
co-pays, no deductibles,
yep,
no nothing,
yep, gotcha.
okay? Do anything you want to do, okay? More expensive, maybe a little less concern, you know what your medical expenses are gonna be for when you pay your premium, you know you're not gonna get any more bills, you're done. You're not getting co-pays or deductibles, you're paying monthly premium, okay? So, I mean, that's basically, with the Medicare Advantage plan, not too sure, you know? You have a bad year, it's gonna cost you more money out of your pocket. Medicare Advantage plan, Medicare supplement plan, you have a bad year, you have a bad year. It's gonna cost you monthly premium every month, okay? All right,
Yeah.
kind of the best way, kind of one way to explain it, okay? A little more liability with the Medicare HMOs. But if you're healthy, you don't have any health problems, not necessarily a bad way to go. Okay, if you don't see the doctor a lot, fine, no problem. I have counselors that have zero trust plans. They're fine with it. Okay, they're fine with it. Not a problem. If you're healthy. But if you're not so healthy, you know, you might wanna, if you use the system, okay, if you're compromised, you're gonna use the system a lot, you might wanna look at a supplement plan, if you can afford it. It's all affordability too. You're not gonna get any zero-cost Medigaps, they're not there, okay? So it's the system as well. All right, yes?
Is Blue Cross Bronze
Yes,
a Medigap?
it's a Medigap, Medigap or supplement, yeah,
Okay, thank you.
okay?
Yeah.
Terminology is crazy a lot of times,
Wicked.
and I gotta, and we've gotta try to improve that a little bit. The terminology is crazy, we've gotta try to improve that. Maybe if I come back next year, we'll have it improved, I don't know.
Would you consider the Blue Cross Bronze the Cadillac?
Would I consider the Blue Cross Bronze a Cadillac? Supplement plans are good plans, all of them, okay? They all provide identical coverage, okay? Blue Cross, Blue Shield, lowest cost for core and supplement. So, it's the cheapest plan. Why is it cheap? They sell a lot of it. There's a lot of it sold. It's a big market, and Blue Cross probably has 75 to 80% of the market. So guess what? They can have lower cost plans. Okay, they can have lower cost plans. Okay, so you ask me, I'm not into somebody spending more money for something you can get cheap. I'm just not into it. Okay, I'm just not into it. Okay? So I mean, that's, you know, I can't recommend anything, but there's common sense in this business. A little bit, not much, it's too complicated.
Where is it?
But you know, there is a little bit, okay? Yes, Margie?
I just want to add that if you go with a Medigap, you want to make sure you get a Part D standard.
Oh, you need a drug plan with these things. Yeah, you need with a supplement plan, you need a drug plan. You have to have drug coverage. If you don't have drug coverage, Medicare is going to ding you. They're going to charge you a penalty at some point in time when you do get drug coverage, okay? That penalty won't be much. Might be 34 cents. But what it is, it's 1% of a benchmark premium for every month you don't have Medicare Part D, okay? Benchmark premium is probably a $34 plan this year, so it's 1% of $34, which is 34 cents. Is it 34 cents? And it'd be 34 cents for every month. Very, very complicated. But the penalties for the rest of your life, it could get involved. Get a Part D plan when you sign up for Medicare. Even if you don't take medications, get a cheap plan. It'll cover you. Okay? All right, moving right along. I just talked about the 2% COLA we're getting, and that wonderful? And I say here, Part B premium will probably be $134 a month for most beneficiaries. Don't want to scare you, but it could be that high. I hope it's lower. Okay, I don't want to scare you. It could be that high, but I hope it's lower. Income-related premium adjustment for Part B and D. Oh my God, what is that? Big words. Here's the deal. If you make more money, you know, if you're doing well in this country, you're doing well in this world, and your income is above, you're single, and your income is above $85,000, okay? Don't know, the way it is, not asking. If your income is above $85,000, you're going to get dinged in the Part B business, okay? They're going to tack on an additional adjustment of 35% onto that $134. So you're going to pay more. You're going to pay an additional 35%. And that goes up in increments. Okay, it goes up in increments. So depending upon how much money you make, you could pay a certain percentage more for your Part B premium. Okay, and your Part D premium applies to Part D as well. Okay, applies to Part D as well. Okay, so you want to be cautious of that. If you're doing well, you know, be happy about it. I'm happy for you, but Sam is happy too. He's going to get a little bit more of your dough. Okay, so that's going to happen as well. Finally, ladies and gentlemen, new Medicare card is coming. Okay? Brand new Medicare card. Hot off the press. Going to be in the mail to you. April of next year, starting on April 1st of next year, ending in April of 2019. In that period of time, we're all supposed to get mailed new Medicare cards. Okay? The new Medicare cards will have a different number on it. Different number. Okay? It will not be the present number you have on your Medicare card. It's going to be a computer randomly selected number. Okay? So it could be anything. It could be numbers, letters, capital letters, another number. Could be anything. So it's randomly selected by a computer. It's no longer going to be the number that's on there. Okay? So they're going to come in the mail. Okay? You want to make sure that Social Security has your correct address. How do I know? If you get mail from Social Security, and you should get a statement every year from Social Security, you'll know they have your right address. If you don't get a statement, maybe you're gonna give them a call and make sure they have your right address. Okay, so they're gonna be mailed to the address of record. Now, unfortunately, they're gonna be paper. They're not gonna be plastic. They didn't upgrade the Medicare cards. Okay, so here's the fault of that. Now, I can ask anybody in this room, anybody in this room, what's your Medicare number? You can probably tell me. Tell me the digits anyway. You know what it is. Okay? I know what mine is. Okay? I can ask anybody in this room, what's your driver's license number? You're going to have to look in your pocket because you don't know what it is. Your driver's license number is a randomly selected number. Your Medicare number is going to be a randomly selected number. So guess what? You have to pull out your Medicare card more than you ever did. Okay? And it's paper. It's going to be abused. I can just vision it.
Yeah.
You go to the doctor, put it in your pocket. Next thing you know, it's running around the washing machine. You know what I mean? So it just happens. It happens to the best of us. So guess what? Here's the deal. Laminate your new Medicare card.
I was gonna say, yeah.
You can laminate it, okay? I'm not going to tell Alexa a business, but maybe you want to do a laminating machine. Laminate your new Medicare card, okay? Less chance of it being damaged or something or abused, okay? All right, so that's a plus thing. Just want to make sure Social Security has your correct address. Okay, that's the important thing with the Medicare card. All right? Now, they're going to let you keep the old one and keep using the old one until December of 2019. Okay? So you can use either one up until December of 2019. If we're all around in December 2019, guess what? You're going to have to start using a new one all the time. Okay? That's something to look forward to. I want to use my new Medicare card all the time. I don't want to depend on that old stupid one. But they should have done this years ago. Okay, so little comment on the health safety net. The health safety net is, again, is a program that will help people with their Medicare costs, okay, if your income is below a certain level. It's a mass health program, okay, and if your income is below 300% of the federal poverty level, okay, which is approximately maybe around $2,800, $2,900, don't know exactly, you can get some help with the health safety net. What does it pay? It'll help you pay a hospital deductible if you have a Medicare Advantage plan. Okay, it'll help pay a hospital deductible if you have a core supplement plan. And basically, if you get your services at an acute care hospital, all of your services, your doctor's offices there, everything else, or you get your services at a community health center, the health safety net can almost act as a supplement for you. But you have to get all your services at that site. Okay? Yes?
How do you get the printout of the income levels?
Excuse me?
The income levels.
The income level is,
I know, but how do you
Maryland
get
has
it?
that, yeah. Huh?
You have it?
Yeah, Maryland has that income level. I just don't have it with me for the presentation.
Yep, this one.
Okay? Finally, I want to talk a lot about Prescription Advantage. Prescription Advantage is a state program, and what it does is this. It'll help you pay for your prescriptions if you hit that donut hole. Okay? If you hit that donut hole, it's a little extra insurance. It'll greatly reduce the cost of your prescriptions if you take a lot of medications and hit that donut hole. All right? So that's a good thing. It also, if you have a Medicare drug plan, Medicare prescription plan, okay, it'll greatly, what a Prescription Advantage plan does, it gives you the opportunity to join the prescription drug plan during the year, to change prescription drug plans or change health plans during the year. It's a special enrollment that will give you that opportunity, okay? So Prescription Advantage can be a very, very, very good program for people to join. Most people, it doesn't cost anything. Okay, most people, it doesn't cost anything. So it's a good backup. It's a good backup for you to join. There's a number to call. You call 1-800. You call 1-800-AGE info line. Okay, and you can ask for a push option 2, and you can do an application right over the phone. Okay, Prescription Advantage, key program this year when there's a lot of switches and involvement with different drug plans. Okay. Any other questions? Okay. A little thing about the Medicare summary notice, or the notice that you may get from your Medicare Advantage plan. Okay, that lets you know the services you're getting and keeps you updated on that. All right. Anything else? I want to thank everybody for having me. Okay, great day in the dark here at Lancaster Senior Center. I hope the hot chocolate was good. And again, was Barbara? Barbara's here. Barbara, come in. Margie's here. Gretchen's down there. I mean, so if you want to set an appointment with a Shine counselor, you certainly can. Okay? Thank you all very much.
Thank you.